Let's bring in a medical voice to talk about this right now. Zeke Emanuel, University of Pennsylvania Vice Provost for Global Initiatives and former Obama healthcare policy advisor. Dr. Emanuel, thank you for being with us. It's good to see you.
Good to be here.
Let's talk about what you think right now, where we stand with this, what's likely to be the situation here in the United States.
Well, first, I would note that if you look at the NASA satellite nitrogen oxide observation over China, which tests, industrial production, car driving, it's virtually clear now. Nothing happening in China. And I think that leads you to the problems that was noticed. There is a lot of fear, and there are a lot of people who are worried. I think for any individual, as pointed out, the risk is low, but collectively, from a public health standpoint, there could be big risk. I think what we're going to see in the United States is we now have 80 cases, but as we test more people, you're going to see that number rise, double every day when we really get testing out there. We know that in Washington State, for example, it's been circulating in the community for at least 6 weeks, back to January 20th or something like that, and it certainly has been passed from person to person. We know that long-term care facility, there are going to be a lot of people who are probably infected. And I think, that does stimulate fear. This is a lot of psychology, as pointed out, but psychology does play a big role, as you know. It plays a big role on Wall Street, and it plays a big role in how people are acting. I've noticed at the University of Pennsylvania, the phrase "an abundance of caution." You're going to see that where people are going to say, "Well, maybe I won't travel to this meeting. Do I really need to go somewhere?" And I think, you've seen the airlines; they recognize it. You're going to see this for all sorts of cruises. I think are down for a very long time because I think people are they're cautious, and a rate hike isn't going to change that kind of behavior.
Zeke, you point out the long-term care facility there. We're focusing on that because, particularly for people who have underlying conditions, this virus seems to be a little more deadly there. That could be the worst-case scenario, to have it breaking out at a long-term care facility.
Yeah, so there are several things that we know put people at increased risk. Older people, probably the immune system isn't working as well. You've got comorbidities, that's other conditions like chronic lung disease, smoking, obesity, anything that compromises lung function, congestive heart failure. You're going to see that have a big effect on people. The data are that young people don't seem to often are asymptomatic or very mildly symptomatic. Again, in that Washington State case where the guy came back from Wuhan and passed it on, and they saw it pop up late February in a teenager, he recovered at home, no problem. And so that's the scenario you're seeing. Let me remind your viewers, that doesn't mean that if you're young, it can't be very serious. It's just a very low risk of that, kind of like the flu.
It strikes me that because there's an incubation period of up to 14 days, and because we're just getting those testing kits out, any snapshots that we're seeing right now are basically snapshots of where we were a week or 2 weeks ago in terms of what this infection was. That may be the concerning part.
Yeah, the 80 is clearly a very substantial undercount, and it's just an undercount because of the testing. And that's probably true in China, too. We don't know exactly what their protocol is. There's some suspicion of the data at the moment, but I think the main issue is get more testing out. And it does raise an interesting dilemma. Who do you test? Because if a number of people are asymptomatic, do you test people? We do need some sense of prevalence, which is what's it like in a community, say in Washington State, where we know it's in the community, what's the frequency there, and how many people will convert to a serious illness? And we just don't know that, given the fact that we've had all these problems on the testing kits. Hopefully they'll be resolved very soon, and we'll have a lot more widespread testing so we have a real handle on the epidemiology, who's getting infected, how it's spreading, and how much it's spreading to people and what proportion of people are actually getting sick. That'll be very important for making prognostications about how bad this is. Let me just say one other thing. The president keeps talking about it's going to go away with the warm weather. That's possible, but it's also not possible. We don't know, and to make make basis of policy on that, or to use that as a basis for policy seems to me to be a mistake. We need to prepare for the worst and not hope for the best and make our policies on the hopes. We need to be prepared that this might not go away.